graduate?
So we moved in 2000.
You actually did.
Not from there.
All right, well, you probably don't know.
I can make enough copies.
Did you? Yeah.
Actually, for county commissioner and also a board member. Yes.
All right.
Dan Dornan, thank you, and welcome.
Thank you.
A large organization, so you'll have a. Nice thing about it is HR is.
Jim was going to throw something in. Adjournment, yes.
All right, let's go directly to the business items then, and.
Oh, you're recording. It is.
For all those who are listening, we are being recorded and virtual. A copy of the recording will be posted to the website. Next item is Kimberly with the CCS update.
So, I just want to do a time check because typically when or I presume if you want me to talk that much this time, or because I see you have a per diem policy and you have. Do I have?
Brevity would be.
Give me a time because I came with an hour and a half conversation, so I want to make sure that I'm. Okay. All right. And if you wanted to do the per diem policy first.
Roger, it's a great.
All right.
Have you met anyone?
The new guy
So you met me.
well, really introduce myself. Where were you before? I heard that you were down in I heard that in information a while ago, but where have you been in between?
Yes, I mean, for 9 years.
I guess I should have known that. Please bring.
Very good.
I don't know what to say to that.
I'm in the same boat. I did too.
Just to remember the law and the
All right, well, I have some things that are not in your packets, so the newsletter give you, your inside the hood of CCS, and outside of the surgery. We have, community, she does a great job. So, just if you have a moment, that talks about, she did?
Yep.
Yeah. Who rehired her?
You're
Is
reminded
it
that
NACO or NACO? Because I've always said.
NACO, National Association of County.
Yeah, so, good things in the newsletter. Program spotlight. Was housing and community. Feedback. John and I wanted to mention the RFPA.
Sure.
I'm going to just give an overview. Or do you want to give this overview?
Go right ahead.
I'll start it, maybe you can. So, all of you are probably familiar with the rural health funds. I learned recently that public health had a call out. But I call out, I start out. And John and I were talking about it might be best, the easier or helpful possibly, yes, if for to develop a crisis stabilization plan. You can have 3 proposals for submission. Trying to use the right language.
Entity or submission?
Well, see,
Entity gets one submission with 3.
3 parts. You can apply for 3 different areas, and you have 1 submission. You have to, each submission has to have a dollar amount of at least $200,000. And they will award, don't quote me on, like 30 awards to entities that put in for funding between the $200,000 and $400,000 mark. And I want to say 20 for those that put in for higher dollars. The maximum for is $5 million. If there's something like 160 million that's going to go out. Yeah, but yeah, in this first round, though,
okay.
it's less. You're probably right.
Cindy tells me right now. I'm used to it.
You have 2 budget periods to spend the funds in. First budget period, using the funds for a remodel. And use funds for operational costs. I am shortening this and said 40. So this is good. Anyway. What would you like to add? We probably have conversations. John has been talking with you. Be willing to do that. Just doing detox, working on getting it. Does work. John conversations. Would be more appropriate. The rules for that are out in draft right now. By the time the final
Question, so you said 200,000. Guys,
we're waiting on the
Marty's gonna come up with
yeah.
some figures.
I guess my question is, something, is there any place that while we're waiting?
the first year. I should have clarified, but I'm just trying to be shorter. The budget, the first phase is 1 year long. And that would be the remodel. And so Dawn and Marty thought that could possibly maybe Marty doing it. And those funds have to be spent by September of 20. There's some overlap here with these budget periods. And your next budget period, the funds. So
So that you, whatever whatever it would cost, could you combine the building, all that remodeling, would be eligible?
Yeah. And again, there's an overlap between these budget periods. And so you could possibly start your phase two if your building is done with the remodel for September.
So my question is, phase one, is phase one strictly a remodel phase, or can you all in one, in phase one, $200,000 for remodel, $400,000 for standing up lease, $500,000 for staffing, all in phase one?
I think the phase one request is gonna be for the staffing, but you can start the spending for period two at the October 20. It's just a couple of things.
So all of these have to be new facilities?
Well, the programs need to be. You can spend a small amount of funding, and it's not specific. Earlier, they were saying like 120. You can spend a small amount of funding on capital, like the remodel. That's what you're really wanting to see is remodels, not building and doing a new build from.
The fastest we're going to be services.
If you want to do a crisis stabilization, you need to do a remodel. Then after that, we can do a deep. There's a few things that should be done. It's ready to go. It's just getting it done.
I like the price.
Well, get started is remodel. And if that's
I think what
fun,
Dan's
then
asking,
we can.
if I understand you right, correct me if I'm wrong, what he's wanting to know is, while the remodel is happening, is there a possibility of putting in the price stabilization in a different facility while this one's being built to completion, and then move it over to that one? I think that's what you're.
Anything to get services.
So if you want to do a crisis stabilization center, John has read the rules. There are specific requirements. So when you think about the physical space of the building, each individual needs to have a 3x7 space, 5x7 with a partition in between it. X amount of space for bathroom, easily accessible.
Eyes on.
Right, you have to have observation. So my guess is, Dan, and I have not looked at all of that are available. But any building that we look at require.
Yeah, oh, yeah.
I
If
think
you look
the
at the rules, you said so.
No, I get it. I just.
if Marty comes back and says, well, I'm going to get the dollar amount. I don't know if Marty's scheduled this. I'm kind of hearing that he feels like he could do it.
He did, but it also depends on who you talk to. If you don't want to talk about it.
Right.
What I understood from Commissioner Timmons is Marty would be able to maybe do part of the work and then maybe sub part of it out, is that right? But it depends on what the engineering comes back. Nicole, is that what you're talking about?
Oh, Pinnacle, yeah, I mean, we could have Pinnacle. You're an architect. Okay, this is the best way to do this. I also think that we figured out a way to do it that would work. But if you really want to do the very best,
Well,
then it would be using an architect.
I would agree with that. The other thing is Marty now has blueprints thanks to that. Has blueprints to put it.
But it has just about anything.
Ease to the king. So hopefully Marty will have a better idea once he's got the blueprints. And got a little-
The other thing I would mention is that even if we don't apply for this, which I think we should, I mean, I just work. You guys do whatever you want. We do have the funds. Service elements that were set aside for DEHOC. So it could be used for this. Probably, we pass those on to CPS, so we have it in holding for you. Which will also is very similar to the model to pay for the startup cost. As John and I were talking, the first year you're building up your client on out of the 100. So you have these pain points the first year where I only have 1 or 2 people, or 3, but you're paying for a full contingent of staffing. The rules say you have to have this many. So that's a challenge. And then the other thing that I would say, and so you have to have the funds to cover that, and that's why we call it startup. The other thing that I'm going to say, and this is true even after a year, is that sometimes it's you have to have all the staff 24/7, even if you only have 2. But you're not going to pay the bills. So the we will be having very candid conversations with you about in the city. The other thing is CPS can't operate this and lose money if we're only having 1 or 2 or 3 people there. So how are we going to come together and make it work if that's what happens?
I told you this before, and I still maintain if Rob Corbett were sitting right here, he'd tell you to fill it up.
I don't disagree, and if they have Oregon healthcare plan and they criteria and they want to stay, and we need to talk about this, they want to stay, then we can fill. We'll get reimbursed for that. The crisis stabilization is a voluntary facility.
That's
They
a
can leave
detox.
at any time. So Rob might say, or a city officer might say, we have this place, would you like to go there? And they can say yes or no. They can also say yes and come for an hour or 2 and then ready. So I always, give you the good, the bad, and the ugly. Sometimes these places have trouble and they have or we're going to do it.
On this rural health transformation, and the county is the one that's how many commit?
But you only have 2 periods. So far. This is the biggest one. They will be doing this one for the remaining 30.
I guess my question, can the county apply for more than one?
That's why I was, before I realized that there was a public health call out, I was talking to John, you need to get your and John didn't know about this grant, and that was surprising to me. But I guess the reason why you guys didn't know is that the call out for smaller, about Umatilla, they did it by county size. So 300. If he had some ideas. Cindy, I can share this with you.
Well, that's okay, because
You have 5 categories that you can apply in. You can. uh, It's, this would be, John and I, but it's, you don't have universal access.
They're expanding home visiting program, that's what he did. But, CARE also applied.
Yeah, and they can apply, they're not applying for you, they're just,
So we have to only do one application, right? So CARE's putting in,
this character of the county.
yeah,
So then, yeah, sounds like Kara's talking.
Well, Jim let me know that. The CARE
I didn't know.
Well, they haven't.
CARE applied for these funds
No,
also.
they haven't, they couldn't have applied already because they haven't come before.
One application can be in, but there's 3 spots for it to be in, so don't let that apply until we get ours in.
Different.
Then just think they're doing it once.
I got a question. You said, obviously, there's gonna be periods of time where you don't have people. How much capacity does this facility gonna have? 20, 15, 10?
So say,
So what is break even?
roughly. And I just found it, so it's increased availability of mental health and substance use disorder treatment. 2, specifically, we're looking at HC2G, which is establish or expand the closed service gap for living with has mental health. Right? Yeah, so, yes, that's why it would be great to get this grant, because then you can say the use of the 66 funds for year 2 or 3 or.
And the SC 66,
That we continue to get. Yeah, so that would be, the plan would be to backfill those, and right now there's a nice pot of money, but I think it's around 100 a year. If you ran in the census of 2 all year, you're not gonna, you'll burn through that 100 quickly, but it's. Right. That's big.
But these all have to be concurrent applications. We maybe, we need to figure out.
what Joe told me that Kim said it gets with the goods.
You know, some,
Well, why? Without coordination.
I don't want to shoot our one shot and not have all of our ducks in a row.
So John's gonna be writing this. Stop. Back surgery at some time, don't know. So I don't think I'm gonna. Hold on, first we can see a little, but. Are there other questions about this? I
guess make sure that the commissioners are aware if we go this route.
but you can change it again, but it'd be another remodel.
But I mean, just make sure that, you know, have it there.
But we could, this It won't be an exact detox, but we can use it before detox.
So if you have somebody who's intoxicated, can they take them up there?
They can, but it's not a detox facility.
Right.
It's, they can sober up. They're not, they don't need any medical. We have to make sure that we screen them. What is it? Crisis stabilization center. So anybody that is struggling with mental health or addictions issues that would like to go, so I say, so maybe they're under the influence. They need a place to go. They don't need to be home, they don't need medical detox. They need connected with resources, they need sleep, they need food, they need to calm down, they need support from peers, they need to talk. And then we definitely work with them back in 1 to 3 days. It's chair, like a really nice lazy boy group. They get to stay in. There's what do you call those?
Chemicals?
And then there'll be a common, it's a drop-off facility. But there will be screening because we would not be able to take somebody that needs a medical detox. So law enforcement can't just drop somebody off that needs that.
We'd like
We
to.
will not have the capacity to following them. They will need hospital, PTs, or they need other or active.
We have a detox facility in. Yeah.
Or I'm looking at John,
No,
because
would be the
you,
answer,
No,
I mean, you could have both. But
but not the same.
when John and I were talking about this grant that came, are you interested in this? Do you want to do this? Do you not want to do it? Doesn't matter to me. We can continue to pursue the detox. And I feel like John thought that a crisis stabilization center, I will do whatever if you want.
That's like crisis stabilization. Let me ask you this, if you had the ultimate authority, you had a magic wand to wave, at the end of the day, that could be either a detox or crisis stabilization. Which would you-
Well, I'm thinking about what the county has talked about, and what I hear is that you want someplace to sleep. So that's the reason why it's like station. I just need to be clear that it's not appropriate for the folks that we just talked about. You're also not gonna get people from other communities if you do a crisis stabilization. It's very ticked off if they bring some over from another community, well, and your local law enforcement. But let's say somebody from they bring a person up here and then they want to leave after an hour, you don't want me to just walk out on your street, because we already have your
So,
well, Grant County and officer. It won't drive people that are voluntary. So the good news is it's just going to be Morrow County folks that are using it. Detox is different. While it is voluntary, people are not physically doing very well. So most of the time, they're not going to get up and walk out. And they're also going to have a discharge plan, usually into a residential. When they get done with detox, they direct.
if the same Grant County guy had somebody to go to detox, and then an hour later they said, screw this, I'm out of here.
That could happen, yeah, but most of the time, wouldn't be as much. Which is why they will not. They'll just be served.
I saw Rob in the hall. And said, what would your thoughts be on a crash stabilization? He didn't hesitate. I would love that. And that's the city manager proposal.
I do think that education has to get done with law
For sure.
enforcement because
sure.
they can't. We need to do a screening initiative. But they can drop somebody off, they're hanging out there. To make sure. Unless they were already screened. I think that'll happen.
And that would help to be artist.
So sometimes CCS goes up and does the evaluation. The person doesn't need the ER and they don't.
There's
don't
no other
need to
place
be
for
on
law
hold.
enforcement to take.
And it will be a great resource for those individuals. Yeah.
All right, we can move on. You guys, I mean, since you guys, whatever you guys bring back.
Attorney moved in the last.
Maybe in the next session. No, it really didn't happen, and there was discussion, but.
In terms of upping what the minimum for six people.
There was a little bit, but not a lot. So I would love to talk about but, biggest thing that they could do would be to open it to folks who are struggling with behavioral health issues, not just. That's where this would be a whole bunch of relief. And then where it did drop just a little bit was the threshold. I've been talking too much. The building.
Jennifer does that, so you're gonna
So-
step soon.
I used to give the example, I actually don't want to give this example. So there's really no good example. It used to be imminent, so you were, still is mostly, but you have to not only have the means, but you're walking on for now we can look at 30 days of behavior and include that. So if you don't have to be walking today, but if you walked 2 weeks ago, you can. That's a reason. That has helped a couple of times in your life.
In terms of voluntary.
Somebody's civil claim, not all.
Legislature. When the person is.
They can't refuse, have to do a meta override. And to. We do that.
Are they allowed to fall?
No, there's different levels of facilities though, so there's, might be committed to a residential facility as opposed to a secure residential facility. We have one of those in Portland and they can. And we have to. If you have the order. for simply like breach and where that's not going to also have an outpatient movement. So that's why I meet with the judge every week or two. If you don't do that, then they get more.
This facility, if they be voluntarily. This is the proposed one. I'm under
We would not have people on a civil commitment. Suppose you could have them on an outpatient.
You guys are, I guess the real thing is, even, we haven't applied for.
Right. Which one is easier to staff?
Price stabilization. Down. So your detox, you have a director that has the endorsement for addiction, daily rounds, prior, have a MHP, has those parameters. So, close to a pregnancy stabilization center where you have to have treatment team, with X, Y, and Z, but you don't have to have all of them. You have to have your staff that is a member of the treatment organization. We will have a look at Cindy because your wheels turn. Hard for me when sure. Well, but we're gonna get, John's gonna be writing for, this grant is due in 3 weeks. But I guess you guys. Okay, I have 5 minutes, so there's.
Oh, yeah. Go.
Okay,
So,
okay.
next time we won't schedule other items.
I said, Doug and I have been talking. I haven't heard, wanting to check in. Real quick, opioid fund, settlement fund. Are you okay if I just? Settlement funds that the county receives for opioid dollars, you put those for municipal program, municipal court program where we hired here. The county. The East End Pier has been very active, doing an amazing job, really since day one, and that's great. The purpose here, we hired somebody and then they left, and we were not able to hire somebody. Right? So we've kind of been sitting in limbo with that, trying to decide what direction to go. All of that, actually. A number of years ago, Morrow County wrote for an impact that are hitting both the jail and the hospital. Same people hitting the jail and they're high utilized. Morrow County knew when they wrote for this grant, they themselves would not have enough people. But they had like 5 or 10 that they knew were required, and they were causing a lot of corruption in the system. But again, they knew that see what it was. And so they approached Umatilla County website and said, maybe you want to do this. Can we provide these services? And Umatilla County said, yes. We don't want to have anything to do with it, but our jails and our facilities. So we staffed up, we were the grant, were awarded a grant, and this impacts program has been one of the most successful. They love it, and we get asked to talk about it all the time. I say it's a Morrow County program because you would tell funds go to Morrow County, but again, I want to highlight that the majority of the services provided in Umatilla. 3 staff, including a supervisor, 2 that are really dedicated to Umatilla, 2.5, and then we're on. The CJC, when the governor said all the programs need to do a budget reduction, was this last fall, I think. Everybody had one. JC decided to cut impacts because it was, that's the name of the funding. Just call it here. It was roughly about a 30% reduction. That's the program. I approached John recently and I said, hey, John, what do you think about taking a performance to use that to back up tax because our Umatilla County is utilizer and we would like to know reductions to this? And John said, sounds like a great idea, right? And so.
And also, we talked to Dale.
Dale.
Dale
Yeah.
said the same thing. He said it was a really successful program.
Yeah. If Kenny Franks were here, he would talk about how incredible it is that you just pick up to Leanne, supervisor. We have one, big checks, hospital, most of the already knows that. They come down to the jail and work with the person, and they're getting service. And that ER loves it, the impact. And it's not a crisis, they know this person. So these folks are hopping, they have great data, they make great connections to all peers by trade. And I think it's a love program in human world. So I asked Doug, can we update the contract? And Doug said, well, is it serving addictions? And I said, yes, because that is what the majority of it is. Admittedly, not all of it was addiction. And so Doug had some questions about that, and I said, Doug, the administrative rules, and you guys have them. And if you look at page 5, I'm saying a lot. I highlighted how the funds can be spent.
We also have family.
Okay. So, well, that's where you're going to see them. And so the OARs say that you can use funds on addictions and mental health. And pull the data for me. About 5% of the are mental health, 95% addiction. We do need to make a decision on this. I did, when John said, Jess, that sounds great, admittedly, I jumped at, all right, reductions from your fund. And then I thought, well, can you Doug and get the contract updated and MIP funds over, and then Doug had some concerns. But it's possible that you also emailed me back that we've been working about this.
So can we use those funds for impact or no?
You don't, that,
We'd have to. Guessing we would have to get.
the affirmative ones are many.
Hermiston is good with it. But I can facilitate those conversations with you, like whatever you would like to do. Hermiston has not been starting their meeting for Hamilton report is also. I spoke with Dr. they felt that it was a good use of their funds. They didn't have.
It's pretty clear. in what the
Alone.
So what I read, and I could, that's why you're the attorney, just not wanting to. We all know that I'm a club gal, but it says, I won't repeat all of them, but it says substance use and any referring for mental health. And
It starts with opioid. And. Correct me if I read it. Or.
And as I shared with the, and I have the data really in 5%, it would be easy enough to just say, referral for somebody that is mental health only, Umatilla County, that we're not able to serve them with. That would be fine. If that works.
And that definitely no.
And any documentation that you want from us, or if you would like to be part of the conversation with the supervisor where I say that, I want you to feel comfortable with what. Okay, those are probably the most important things, but I could go really quick with the others. Do you mind?
Yeah.
Okay. We're not gonna go through this. I always give it to you. Customer satisfaction survey, you can check towards the end, look at. Okay. But let's go right before Wheeler and combine agency totals and how we're tracking. I can only, you can pause me or you can, I generally give you the warm line report. Yeah, it is. And we see the state of one. Well, the numbers are growing. And so last quarter, the warm lines were 22,000 people. And then the jail MOUD program that you have is incredibly successful. I'm going to brag just a little bit. At any given time, we're serving about a third of the population. That are used to work. But they're availing themselves in our
It's lower than I thought it would be. Unfortunately, I think that's low.
We're also getting more people signed up for the injection. We like that because the tablet is good for 1 day. Every day underneath the injection is 30 days. And it definitely produces something significant. To leave the jail for 30 days. Also next to follow opposed to leaving the jail with 7 tablets. Lost or they hook up with their drug buddy or whatever. Good to do the injection. It's quite a bit more expensive, but $10 a tablet, $300 a month. As opposed to shout out to that. Funding wise, our funding we expect it to stay flat. Our decisions to make budget think we're gonna see last week that like report, our law enforcement program, engagement program also is amazing. So Brett put together a little, page here on what we're doing. We've reached out to almost 400 employees of different to provide QPR. We'll talk about that in a second. Next week is Safety Week. We've been invited to do presentations. We'll be presenting on other CPR programs, doing a lot of QPR training in the community, work with credit assessment, we'll talk exercises, presenting today at the Fair District Fair Academy on resilience. So you have the zero suicide, upcoming trainings that we're doing. Melissa's really been reaching out to the schools. The very last page is doing QPR training in the schools. And the third page there in this packet is the national rate of suicide. They don't really legs a little bit, but Oregon ranks 6. There's a lot of
Incidentally, the same number of suicide or eventually a day.
terrible. I wanted to mention also briefly CCBHC, clinically certified community behavioral health clinic. We became, and Grant County became a CCBHC back in 2019. Not known by like BHC and Umatilla. And then they closed. The window. They recently reopened it, so we are for. Well, we did receive CCBHC certification. What that means is we'll be doing more for chronic health conditions when they come to kids, not just behavioral health, and writing more referrals and getting with primary care. We know that there's high co-occurrence diabetes, pressure, and high blood pressure, of those things. But we do provide the referral now that this is funding to have people that are specific. Right? It's financially that's the only area where and access is good. That was a big thing for a while, but you're gonna get in Umatilla County for an assessment generally in about 2 weeks. Okay. I did an hour. I did, no wait. I did 58 minutes.
Right. Any questions for Kimberly?
Thank you for bringing the new HR director, Justin. So awesome to meet you.
Nice to meet you too.
Where we'll set it up where we don't have.
Where do you want to go? Do you need any additional?
I'll let you know.
Hang out. Okay. Good to see everyone. Thank you.
For Diem Policy. Oh, everybody has a copy of the one
Yeah.
that put together.
This was, for employees for
Pretty straightforward. Personally, I don't have any problems at all with the rates. That was- but- Definition of traffic signs, there are. How many collective bargaining do we have in the agenda? Yeah.
that.
Okay. Anybody else?
Where did you come up?
So I took the GSA rates and originally took them from across. And were what average would be met in the middle.
Yeah, there's a few. The one I caught was on page 2 under private vehicle number 2A. Employee will begin their trip with a fill tank. I think it's full tank.
There's some basic.
Okay, so you're gonna, okay, no worries about it.
Just a graph. Okay, appreciate you pointing it out.
All of our policies imported. The OCR.
The policy numbers match up with the. Oh, that.
Currently the policies. In current version. This document, I don't think we're.
This is good to bring back to the commission.
Good with that. You're asking.
Any other items that anybody wants to touch on?
Yes. Two quick things. Bobby Levy reached out to me. County's historically sponsored they're one of the sponsors for the East Northern Women's Coalition. And wanted to know if we wanted to sponsor that again. I think it was less, I think it was like 25. And one other thing, and this might be very minor, but I don't know. I was inquiring about utilizing the new room upstairs on the 3rd floor. And the courts had both this room and that room at the same time. Which meant we could utilize one of the 2 rooms. I thought the reason why we built that room was so we could still access at least one of the 2 rooms. They were insisting that we couldn't have either one of the 2 rooms.
Was it on the day of the trials?
No, it was for May, for the Monday. But at the beginning. So but I don't know, I thought that was odd that we
Kind
can't
of an
use.
overreach.
So I just wanted to bring that up and see if anybody who wanted to address it.
couple of things that were in the pinkies. Pinkies back. Yeah. Not on the agenda.
Oh, gotcha. Yeah, we can add those in.
Couple things. Question on the $5,000 for the voters. Are we only paying for the Umatilla portion of this? Because I thought that the this voters pamphlet funded by the Women of Oregon, the Oregon voters. And I don't know who pays. Man, I thought it was the state of Oregon Women's.
Because every, yeah.
There is a fee for 5,000.
600.
Yeah.
Yeah, it's for the print.
That was my, it may be Cindy can answer. But my degree is going to be signed for the county commission. Anyway, I don't remember authorizing that. And then the next one is one that I should know, but I saw it today and nobody said anything. This is repair to the 22 floor.
That was Cody Markham's patrol rig that got dinged up when the pursuit happened down by Walmart here in town.
Yeah. My question is there enough value left in a 22 Explorer to get it fixed?
You'd think the insurance would have totaled it out if that was
We don't have
Collision insurance.
right.
I'll ask. Who put the shoes up? No. That was all I had. Jason? Perfect. Thanks, everyone. I'm headed to Salem, and I'll see everybody on Monday.